Good afternoon from Nigeria, ladies and gentlemen, and welcome to the August edition of the GET webinar series. I want to say a big thank you to our speakers and our participants for joining us for this very important webinar series again this month. Here are the reason why we do this every month. Like you all know, the GET webinar series is organized by a Global Emerging Pathogens Treatment Consortium, GET, and it has become one of the biggest platforms to discuss emerging issues in the area of One Health, biosecurity, and health security in Africa. Before we go on, for the benefit of those joining us for the first time, permit me to talk about GET for 1 minute. GET is Global Emerging Pathogens Treatment Consortium. As a platform is a consortium that was set up about 11 years ago at the peak of Ebola crisis that ravaged some countries in West Africa. It was clear during Ebola that West African countries, and indeed a lot of African countries, lack the capacity to cope with such level of health emergency and biosecurity threats. And there was a need to set up organizations to work with African countries to build capacity to cope with emerging biosecurity threats. And Global Emerging Pathogens Treatment Consortium, GET, was one of the organizations set up about 11 years ago to work with both government and non-governmental organizations to build their capacity to cope with emergency biosecurity threats and other forms of threats on the continent of Africa. And in the last 11 years, that is exactly what we've been doing, using different platforms and different media to do that. And one of the platforms that we've used in the last 3-4 years is a monthly GET webinar series, which is a platform to discuss emerging issues in the area of health security, biosecurity, and One Health on the continent. And the webinar series have grown over years to become one of the biggest platforms on the continent, attracting participants from over 60 different countries and growing to a level of having over 100 participants in some of our editions. This webinar series have hosted top experts from different fields, including experts from the United Nations, top government officials, heads of private and non-governmental organizations, all to discuss emerging issues in the area of One Health. And today we are having another extremely and very important topic that we'll be speaking on. Today we'll be speaking on digital health. And the topic for today is digital health innovations and data management for strengthening health systems in Africa. You agree with me that we live in the fifth industrial revolution, and it's all about innovation, using artificial intelligence and other emerging technologies to enhance innovations in different fields. And health, the field of health, is not left behind. It is important for us to harness these emerging technologies, innovations, and data, effective management of data to maximize and strengthen health systems, especially in Africa. We have several emerging innovations, precision medicine, using AI to enhance, development of drugs and vaccine, and many other innovations that we can use to build capacity, to strengthen health systems, to increase availability of health and the quality of health on the continent of Africa. And that is why we're organizing this webinar again today. We have 4 top subject matter experts that will be speaking with us today on how we can use innovation and maximize data and different innovations in different countries on the continent to strengthen health system in Africa. And without wasting time, I'll go straight to our speakers. Each of them will be speaking for about 20 minutes. And for our participants that will be interested in asking questions, you can just put your question in the question and answer platform of Zoom. And after the whole presentations, our speakers will be available to respond to your questions. Yes, without wasting or spending much time, I'll go straight to the first speaker. And our first speaker is from WHO. She is pharmacist in Kiruka, Uko. I'm going to read her bio for about 1-2 minutes and hand over the floor to her to give us a presentation. So pharmacist Nkuruka Uko works with the WHO office in Nigeria. She's an experienced health officer with demonstrated history of working in the health wellness and fitness industry. She's skilled in epidemiology, she's skilled in program evaluation, and she has spent a lot of years working with non-governmental organizations on global health and healthcare. She has a strong healthcare service. She's a strong healthcare service professional with a Master's of Science focused on public health from London School of Hygiene and Tropical Medicine from University of London. She has many years of experience working with WHO, and she will be speaking to us on the topic strengthening health systems through digital health and data management, WHO's perspective and Nigeria's experience. Pharmacist Nkruka, we're very happy that you're joining us today. If you can hear me, please, you have the floor. Thank you.
Thank you very much, Dr. Detun. I appreciate being here, and I'm happy to speak from the WHO side on this topic of strengthening health systems through digital health and data. Now, without further ado, we appreciate from the WHO at all the three levels, the HQ and the regional office. We are happy that this seminar or this webinar is holding and that you recognized WHO as an authority in this area, and that we are supporting in a lot of work around this area, and also to have us in the panel to share our view. And I'll dive straight into my presentation. Now, when we talk about data and digital health, what do we mean? Or why do we mention them when we talk about strengthening health systems? Now, we are not ignorant of the rapid growth of mobile telephony and internet access and other technologies. We're also not unaware of the growing need for actionable data at all times about global commitments such as the universal health coverage and the SDGs and the IHR. We are aware of all that. And these are one of some of the reasons why and the current scheme of things in the health sector, digital and data are like the oil, the ingredient that can actually make us make significant changes and achieve outcomes and lasting impacts. And so what do we mean by digital health and data? Digital health, in summary, is the use of digital technologies to support health, such as the telemedicine or electronic medical records to AI decision support tools, and even the supply chain system that we have. And also, when we talk about data, health data is basically around or about measurements, records, and signals are generated by individuals, by providers, from devices, from systems, but they are curated basically for action and learning. Now, a learning system will continuously turn data into insight and improve outcome. And the further in slides, we'll see how digital supports this data and vice versa. Now, this is just about a brief summary about the benefits of digital health for the health system and also about data. One of that for the digital health is about access and equity. We know what access and equity in health in healthcare is, making sure, and of course also the universal health coverage, which is about ensuring that everybody, wherever you are, whether you're rich or poor, whoever, you're able to access the health services that you need when you need it, and with the correct quality that is expected of that. And we know that as one of the issues around achieving UHC is about access to care, access to commodities like drugs, access to diagnostics and all that. The issue of quality and safety of commodities, the issue of efficiency, where we have wastages and all that, things around continuity of care, where there's fragmentation of care. You can't go to one hospital in Nigeria today and expect your records to be in another. It's like where you start is where you should be. And when you go to another, a new record is created for you and all that. And then the issue of strong data about decisions, better decisions, early detection of outbreaks, optimization of the scarce resources that we have, the issue of accountability to some of these, to all the global health initiatives and USC and STG, and the need for research and innovation. Now, what's the relationship between the data and digital? Now, you can't actually separate the two because without digital, you can't get good data. And without data, you can't also do good digital. So it's like a twin that you can't do without any. So basically, digital to standardize and help to standardize, collect and transmit data, and high quality data fuels digital applications like AI dashboards and all that. And of course, interoperability of digital system ensures that data flows from one system to the other. And that also will ensure that I receive care today from a hospital in Abuja where I live. If I go to Lagos peradventure, I fall sick and I go to another hospital, they should be able to call up my data, and look at the history and also treat me instead of starting a new record. And then feedback loops and all that. Now, how digital and data reinforce each other? From digital, you could have a better data, like I've said, like digitizing workflows to generate higher quality, timely data, and embedding standards, embedding what is called interoperability standards, and terminology dictionaries, because when data is not structured, when they are not based on a common standard, it is not possible for this data to be shared. And today, in today's world, a lot of insights are really needed to make things happen, to change things and move forward. And if data continues to be in silos or fragmented, we can't get those kind of insights because we will be getting disjointed feedback from the data. And then the interoperable data systems has to connect different programs. And then, of course, injecting privacy by design and consent and audit trails. These are the things you may not be able to do if you are doing the manual data management. And then using data for better digital, you can use data to optimize the existing digital tools by checking what is the gaps, where are the gaps, where do we optimize. And then also in feedback loops like the dashboards where you now use for action and to improve data quality, and then also in data governance. Now, data as an information, as an ingredient in the information system, let's dive into that. When we say data, how does it help? What does it mean? Data is an ingredient in the information system as it feeds the information system. We'll get to what is an information system later. So it is that basic raw material that you must collect, process, and analyze, that to make meaning. And it provides the structure, standards, and tools to organize. Health information system provides the structure, standard, and tools to organize the use of data. And without quality data, health information system is ineffective. Now, data is like the blood, Data is to health information system what blood is to the circulatory system. So when you talk about health systems, health information system is one of the building blocks of the health system. And so you can't say you're strengthening health systems in anywhere in the world without having that building block out of those 6, that is health information system strengthened. You can't. So, and the other thing about the health information system is that just like the other building blocks, they work simultaneously and in an integrated manner. So if the other building blocks, for example, are being strengthened and the health information system, which embeds data, is not, the overall health system is not going to work. So because the health information system or the data from the health information system is the currency for the other building blocks also. So it enables monitoring of health status, service coverage and system performance, and supports evidence-based decision-making at all levels. And it links with the other building blocks, like I said, be it the workforce, where you have the HR data, the health workforce registry, be it service delivery, where you have quality metrics, be it in medicines and supply chain, where you have your logistics data, supply chain data, and in financing, where you have your expenditure tracking. So the health information system translates raw data into intelligence, which strengthens all other system building blocks. So the logic is like, you have your data as the raw ingredients, which empties into the health information system or the currency of the health information system. And then when you have the health information system strengthening, it goes to strengthen health system performance and system resilience. Now, what is digital health? Let's dive into digital health more not just in summary. So we've mentioned it before, it's just the application of digital technology in health. And we have the examples of like the electronic health records, which is cost-effective and secures information better using ICT than the normal way we do it, where we go to the hospital, open folder and all that, which is cumbersome. And then the mobile health that you can use to collect data at any point from anywhere, using your mobile phones and all that. These are some examples. There are telemedicine, there are decision support. There are many digital health applications. Applications for digital health are classified into about 4. Those that are client-facing, that clients can use to improve services or in various ways. It also has the providers one that the provider can use to improve things. It has a health systems management one, so those that can help to improve the health systems. And then it has the data one. So when you categorize or use or identify a bottleneck in your health systems environment, any of these classes can help you to solve it by bringing in a digital health intervention that is for that area. So therefore, digital health is the convergence of digital technologies with healthcare to improve healthcare delivery and patient outcome. Now, role of digital health in system strengthening and universal health coverage. Okay, we are aware, first of all, that when you say health system strengthening, what does it mean? Health system strengthening is about all those building blocks that has been identified that if they are tweaked, or touched touched the way it should be, it can make the overall system that provides or delivers services better. So more or less, health system drives service delivery. So if you quality service delivery and also if you don't have your health systems strong, then you can't really expect to have a good health outcome or achieve universal health coverage. And as you may know, universal health coverage is just one of the targets of the Sustainable Development Goal 3, which is for health, and which is about well-being for everybody. So it flows from health systems. When you improve health systems, it is very likely that it's going to get you nearer to universal health coverage. And if you go near to universal health coverage, it is very likely that you're also going to be achieving or almost achieving the Sustainable Development Goal 3, which is meant to, the SDGs are meant to end by 2030. So how does digital health help? So digital technologies introduce novel opportunities to address health system challenges and therefore offer the potential to enhance the coverage and quality of health practices and services. Example, to expand service access to service delivery, for example, what can you do? What can you do or to facilitate targeted communication to individuals through reminders or target health workers aid to give them more immediate access to clinical protocols? What can you do? We'll get to that. And before we get to that, let me talk again about the digital role of digital health. Many people suffer because of lack of access to high quality, affordable healthcare. And this is especially more in low and middle income countries. Remember when we mentioned the benefits of digital health in the beginning, where we said access and equity, efficiency, and all those goals. So one example is access to essential medicines and health technologies, which is a cornerstone to universal health coverage and have the potential to save lives and enhance quality of life and well-being of people. So how does access to medicine help? We'll get to that in a bit. But when scaled up, digital health can be a strategic tool for improving access, expanding coverage for UHC, and increasing financial efficiency in the health sector. And it can avail the potential to save lives and improve the quality of life for everybody. Now, a background to using digital health to strengthen systems and universal health coverage is from the understanding that if you harness the power of digital technologies, it's essential in achieving the UHC, as I have said, and in the WHO General Program of Work, which is the Global Health Strategy. And a resolution in recognition of this was passed at the World Health Assembly in May 28, where it was demonstrated, where member states collectively demonstrated the recognition of the value of digital technologies to contribute to advancing UHC and SDG. In fact, it is known and concluded that without digital health, no country can achieve UHC. No, it's not possible because there are inefficiencies across all the health system building blocks that digital can help to close. So if there's no digital to help close those ones, how can we now march forward significantly in achieving UHC? And of course, digital technologies, leveraging them in health is propelled by the global ubiquity of mobile phones. That's the widespread use, widespread access, and other technologies. Now, the goal of UHC is to ensure quality, accessibility, and affordability of services, as we mentioned. And as I also have mentioned, how shortfalls remain in ensuring access to all people. And we will use a Tanahashi model to illustrate how this happens. So this is a Tanahashi model showing layers of UHC achievement affected by health system performance. We're talking about health system strengthening. Now, in terms of affordability, because this is a factor in universal health coverage, in terms of financial coverage, if you talk about the proportion of patients protected from impoverishment due to health-related costs, that is, patients that do not have insurance and they have to pay for the services and all that. How can digital health help? Today, digital will not make those patients will not pay for the patients, but digital can help to identify those patients. Nigeria, for example, today have a vulnerable patient, vulnerable group fund that they used to help the poorest of the poor, and identifying them and generating a list and keeping a database is based on digital. Now, people in the hinterlands, in the villages, in my village, for example, can easily buy insurance coverage. They can pay for the capitation because now in some states there are mobile applications for registering for health insurance. So you don't need to go to a center, maybe in the Ministry of Health of a particular state to get it. You can get it anywhere once you have the link to the mobile app that you can, or you download the mobile app, you apply at once. Then the issue of, for example, availability of commodities and equipment. What is happening? Now, Nigeria have the National Supply Chain Program. But before now, what do we have about supply chain? You have fragmented silo system of commodity supply. And what happens? You have wastages, you have stockhouse. All these things affect what? The quality of services and making it impossible or difficult for some patients to access the drugs or the commodities that they want. What can digital do? Today, we have the supply chain management information system, which has integrated many program needs for commodities and drugs, and which also helps to ascertain how much quantity of drugs or other commodities can the country forecast or plan for, and then with that, how much money will it take? And then also with that, they can look at the supply they have in the warehouse, how much is it, how many facilities or how many places can it cover, and how many people can it cover. Those things are easy to do with digital. Without digital, these things cannot be done. And then the issue of availability of human resources. Today, we have health workforce registry, which is like a registry of every health workforce, every health care worker, at all levels. It tells you how many doctors, how many nurses, and all that, and where they are. Those in the federal, those in the parastatals, those in the agencies, those in the health facilities. And with that, it is easier to manage, plan, distribute, and all that, even plan for the payments, the salaries and all that. Or is there accessibility to health facilities? We have the health facility registry, and many, many more. So you see how digital is closing gaps, in health systems, by identifying those bottlenecks and filling it up with technology. This is another example. For example, you have an intervention of known efficacy. Maybe intervention is about, the other time we're talking about access to medicine or access to whatever. And we have this intervention, or rather, let's use what is here, poor demand for services. Poor demand for services could be because people do not know that this service are available. They don't know that it is available. How can you create improved demand for service? It could be by targeted messaging. It could be by bulk, share information to people through their mobile phones. They receive it and they even know where a particular kind of services are. That can help. And then it could be that health workers do not follow guidelines, because by the time you are with a patient facing you, and then you are not so sure of which step to take in a particular situation in your service delivery to a patient, and the paper guideline or the manual guideline is sitting before you, where do you get to? Digital can be used to digitize that guideline and even make it a model so that healthcare worker can go straight to where he needs to get clarifications on and get it. And of course, provide better services to the patient. The same thing with commodity stock out. We've talked about the LMIS, we've talked about the health workforce registry, we've talked about the health facility registry. So with all those things, we move towards quality and coverage of health interventions. Now, this is also another schema on how digital can help us to close health system challenges, and therefore it gets better service delivery, get better health outcome, better status and all that. For example, let's talk about the last one, loss of follow-up of clients. What can you do when your clients, maybe clients that are registered for maybe some kind of care, let's even say routine immunization, what can be done to make sure that those clients do not miss their appointments? The mothers or the caretakers of children will always bring them. You can transmit targeted alerts and reminders, or have longitudinal tracking of clients' record and status to help to know who is missing and who is not missing. And for that, you can use digital health interventions that are listed in blue. So how does data and digital help build resilience? In fact, you should know from all the things we've been saying, early warning surveillance and rapid response, because it can help us have real-time case data, flexible service delivery during shocks, for example, telehealth services. In Nigeria and other parts of the world, telehealth services, telemedicine and all grew during the COVID because people could not go out, and they are now could, with the phone or other sources, get still services that they want. And what are the risks? If you don't have data and you don't have digital, what happens? The system stagnates, the health system stagnates, because then you will be having delayed detection of outbreaks and slower response time, and of course, higher morbidity and cost. You'll be having inefficient resource utilization. We have stockouts, we have wastages due to opaque, supply chain systems that are not visible. You don't know what is out there, you don't know what you have, you don't know what the needs are. And also inability or limited ability to monitor program performance and outcomes. Fragmented patient records. I've talked about continuity of care, where patients could fall through the tracks, or patients could be mismanaged because the records are not, there's no continuity in care. And then the issue of erosion of trust when data are inconsistent or accessible, or even when there is data, a breach to data security. Now, when we talk about these aspects we've seen, data and digital health, I think by now we have situated well how it sits with health systems and how it sits with UHC and better health outcomes and all that. For WHO believes that digital health and data and the data it generates are essential to build resilient, equitable, and learning health systems. But of course, it should be underpinned under strong leadership in countries, and standards-based interoperability and ethical governance, and of course, are non-negotiable. That you can't talk about the issue of data security and wave it away, because it is germane that those are considered and built into systems, both for data and digital. Now, WHO, in all recognition of its role in these areas, came up with a global health strategy, which is called WHO's 14 General Program of Work, which is what almost all the member states of WHO, about 194 countries of the world, signed to. What is the overarching goal? To promote, provide, protect the health of well-being of people everywhere. And it has 6 strategic objectives, which are this. And it has these ambitious targets to achieve by 2028, end of 2028. 6 billion people enjoying improved healthcare and well-being, 5 billion people benefiting from UHC and without financial hardship, and 7 billion people protected from emergencies. Now, these areas are underpinned also by data. So looking at the role of data and digital health across these objectives, for example, the first objective out of this is responding to clinical change, climate change and health threats. What can be done? What does WHO push? Digital surveillance and early warning systems which help detect climate-related diseases outbreaks, and data-driven risk models which enables targeted preparedness and response strategies. If we talk about number 3, advancing PHC and system capacities, that's health system capacities. We have digital tools like the EMRs, telehealth services, e-learning that strengthen PHC service delivery and workforce capacity. And then we have data from the digital systems, which inform strategic planning, resource allocation, and performance monitoring, and many more for the other objectives. So this is what WHO commits to do and support countries around the world in these 2 areas. Data under data and digital. First, transforming digital health, transforming health sector through digital health, where WHO pledges to scale technical assistance in digital policy, governance, system architecture, change management, and by promoting standards, open source tools, and digital public goods consistent with equity and data governance principles. And also in monitoring and reporting, that's enhancing data availability, timelines, and accuracy through this core technical package, World Health Data Hub, Pandemic Intelligence Hub, and focusing on strengthening national surveillance, analytics, and targeted reporting. These are already being done for a long time by WHO. Now, the judge at the GPW 13 still emphasizes it. So it emphasizes stronger data foundations and digital systems in countries to really help countries move towards stronger health systems and UHC. And for this digital link initiative, WHO has a variety of guidance on that and tools like the Global Strategy on Digital Health, which should have ended this year, but extended to 2027. The SMART guidelines, the WHO SMART guidelines, which curates normative guidelines that you see, the manual and the electronic guidelines, and interpret them into a machine-readable format that is software agnostic, and any digital application in a particular program area can ingest it, and it can do wonders. Nigeria has started rolling with this already, and for the routine immunization, for example, we have finished work around that area. We have a FHIR standard-based guideline that can help interoperability around all the areas of work in immunization. And the global strategy, it was part of the guidance we used in developing the country first digital health policy in 2021 and the strategy to implement it. Also, classification and standards. You know about the International Classification of Diseases, version 11, and the other standards. These ones are actually meant to standardize data, give data structure, so data can speak to each other, and then also normalize or harmonize how countries talk about a particular disease. Some countries, for example, in HIV/AIDS will call it HIV, some will call it other names. How do you have a single or a uniform way of identifying morbidity and motility issues? That is what the classification does. HL7 FHIR, that's Fast Healthcare Interoperability Resources, is not developed by WHO, but WHO provided guidance, in its adoption across the world because it's tested. Now is a global public tool. In ethics and governance, AI ethics in health has been, the guidance has been developed to guide countries to make safe and sound decision that is not risky for individuals in the use of AI. And also in investment in maturity, like the Global Digital Health Monitor, which kind of is an interactive web platform that helps to understand the state of digital health for every country of the world. You can go, if any of this, you can browse it and see what it is. And then what tools do we have for health information systems from WHO? We have for health information system strengthening, like this core technical package, which the country Nigeria even has used in 2020 to assess the strengths or maturity of the health information system of Nigeria. And we've been working based on the gaps we saw. And we have done the second one, January this year, to know where we are and what we need to continue doing. There's a global health observatory where you can go and search all data you want. The hub, we have the surveillance emergency intelligence, where you have the integrated disease surveillance response framework, which you know was developed by WHO Afro, and many others. Now, for Nigeria specifically, where are we? What are we doing? Nigeria has really advanced in terms of our data and digital health. I wouldn't say we don't have challenges or that we are where we need to be at this point. We are not, because there are a lot of challenges, but really we have progressed. We have a national policy for digital health and strategy. The Minister of Health in 2023 launched the Initiative for Digital in Health, and of course inaugurated a 20-man committee to help to build a modular interoperable national digital health ecosystem. And I can tell you, ladies and gentlemen, that this team has really gone far in achieving this and carrying other partners and stakeholders in the country along. Nigeria adopted DHIS2, which you know is the digital platform for the health information system, and even integrated different packages to it. In 4 years ago, Nigeria adopted 32 international standards from the ISO for health informatics. These are domiciled with the Standard Organization of Nigeria. So anybody that wants to do any work that has to do with digital health and health informatics, the person can go and buy some of these standards from SON. Adoption of the SMART guidelines and the digital adaptation kits. Like I said, this is a WHO tool, but it's not a global public good. Nigeria has adopted it and is using it to improve quality and access across program. But for now, we've started with routine immunization. Health information maturity assessment. The health information is changed. That is our readiness to be able to have a system based on our national enterprise architecture, for digital health. That's readiness to be able for that system to exchange data. We have done the maturity assessments 2 years back, and right now we know we were then in about 2 point something out of 5. That means we had a long way to go. By now, we've not done another one, but I think we should be in 3. It is led by African CDC. Then, of course, the EMR standards work. The Digital Health Initiative is working on standardizing EMRs. And like I said, this is a priority of this government. And they are really working assiduously to achieve this. And they work with a lot of private sectors, because in Nigeria, the private sector is huge and is strong and highly technical and very innovative. So they are working with them to bring their works, to bear, for everybody's good. And of course, Nigeria has a lot of partners and investments in these areas. But this year's current landscape, the funds are dwindling. The US policies on public health financing, where even the CDC, USAID are affected, and then WHO also funding and other UNN and implementing partners are affected. So yeah, we have a strong partner base, but there's big issue in financing. So what are the factors that are driving digital health in Nigeria? Our growing telephoning, our size, population as a country, e-commerce and mobile banking, human resource for health shortages, the Japa syndrome and all that, and the lessons from the COVID-19 pandemic. And now, which also led to more teleconferencing and use of collaborative apps for virtual meetings. Future outlook: we are the largest economy in Africa, strong private sector environment, high adoption of smartphones, and legal and regulatory environment that is really developing. Like we have the National Data Protection Act, which I recommend it to everyone to look at before we do things around data. Even though compliance to somebody breaking the rule or the law is not really, the compliance is not so much, and the penalty are also not enforced, but one day it will happen. So around data, we have the National Health Information System policy. The policy and governance environment for health data or health information system in Nigeria is well developed. Well developed. The structure for MNE is good from top federal to health facilities. They have MNE focal persons in local governments, all 744 local governments in Nigeria, all states, 36 states and FCT. At the Ministry of Health, there's a team, a department dedicated to MNE and health information systems. And recently, Nigeria developed the monitoring, evaluation, and accountability and research and learning plan, accompanying the National Strategic Blueprint, the new National Strategic Blueprint, which is aligned to UHC SDGs, meaning that if it is aligned to UHC, it means that it considers all those health system building blocks. And also, Nigeria has the National Health Management Information System, which is the backbone of our data collection and reporting from all the health facilities in the country, about 40,000 health facilities in the country. And of course, strong partner base that supports the government in capacity building and on all this. And in achievements, there's a lot. DHI's adoption, for example, for routine reporting is in all 774 local governments, all states, even facilities now are adopting it. We have the EMRs, which are all over the place. Private hospitals, some public. The only challenge we have is the issue of integrating them. Because if you don't integrate them and they stand in silos, it still leads to care discontinuity. Quality of care to patient may not be enhanced, and the outcome for patient may be may not really be what we expect. And there's a lot, I think I didn't do justice to this particular slide, but there's a lot in emergencies, outbreak response, in civil registration of vital statistics, in surveys. Nigeria has always met the 5-year duration for population surveys, like the National Nigeria Demographic and Health Survey. At least from 2003, Nigeria has been having those surveys every 5 years till date. The last one was the one done late 2023 to early 2024, which the report is expected to have been out last year, but because of the issues with this US policy and all that. Then, of course, strengthen surveillance. Surveillance used to be for just maybe polio and a few, but today Nigeria uses that adopted integrated disease surveillance framework, and that's what they're using to monitor many diseases, both the ones that are outbreak prone and others. And for health information system, particularly Nigeria, all the components of the health information system, Nigeria has data sources on them, have the systems on them. Talk about the routine health information system, which the digital platform is DHI. Nigeria is doing great. Just that the quality of data in those places needs always to be interrogated because they are not always good. And it covers all the programs, including even NCDs. Is it the disease surveillance? Nigeria, that source of data, Nigeria has a good system for that, the system of people, material, processes, and all that. The civil registration and vital statistics, it partners with Population Commission. That's the Ministry of Health partners with Population Commission on that, birth registration, vet registration, implementation of standard-based models, like the ICD-11 and all that. And I've talked about surveys that are regular, mixed survey, DHS, all of them, and even the routine surveys for conflict-affected zones like the HIRAM, which is like the Service Availability and Readiness Assessment. Nigeria have been holding, not really annual, but they've been really trying on what they call health facility surveys, where they try to understand our facilities are in terms of the services that are available per grade or level of health facility and the readiness to provide those services, which now talks about health systems. And then also program-specific M&E system for HIV, immunization, family planning, SCDs, TB, and all that. And of course, we have strong health subsystems like the supply chain system, workforce registry, facility registry, and many, many more. Now, what are the gaps in all this? We have done well, we're doing well. Fragmentation and interoperability issues, data quality issues, weak systems, infrastructural barriers, human resource capacity in terms of number and scale, data governance issues. So the gaps and challenges are there. You can look at it later, but in particular in digital innovations, I want to just share this. Amid the heightened interest, digital health has also been characterized by implementations rolled out in the absence of careful examination of evidence base on benefits and harms. It's happening a lot in Nigeria and other developing countries, even in some developed countries. So enthusiasm for digital health has also driven a proliferation of short-lived implementations and an overwhelming diversity of digital tools, duplications and all that, with a limited understanding of their impact on health systems and people's well-being. And that's where we've seen ourselves, digital chaos, where we are not maximizing our resources. We are having several pilot programs, most of them duplicated, and nobody goes to assess or evaluate the outcome from using those digital systems in improving based on the objective, whether it's clients, provider, health system, or database. And then this concern was highlighted most notably in the consensus statement of the WHO Bellagio e-health evaluation group, which opened by stating that to improve health and reduce health inequalities, rigorous evaluation of e-health is necessary to generate evidence and promote the appropriate integration of use of technologies, while recognizing the innovative role that digital technologies can play in strengthening the health system. There is an equally important need to evaluate their contributing effects and ensure that such investment do not inappropriately divert resources from alternative non-digital approaches. So the trajectory, where are we going? So with the Nigerian Digital in Health Initiative launched, with our standards adoption, with our policies and strategies, with technical capacity, with support from WHO and other partners to the government, Nigeria is on a path to a more integrated, resilient, and data-driven health system. But of course, success will depend and is depending on the scaling of interoperability, building workforce capacity, strengthening infrastructure, governance, and the data systems. And then with this, I say thank you all for listening.
Thank you very much, Pharmacist Nkiru, for that very detailed presentation, and congratulations on the good job your WHO is doing in Nigeria. So without much ado, I'll go straight to our next speaker, because Dr. I've taken a whole lot of our time. I'll go straight to our next speaker, and our next speaker is Mr. Femi Olapegba. Mr. Femi Olapegba is the Managing Director of Digital Health Platforms Limited, where he co-conceived and leads the development, implementation, and rollout of Nigeria's first smart information platform. This innovation platform is designed to connect all health facilities in Lagos State, enabling interoperability, data analytics, and quality improvement across the healthcare sector. Mr. Femi Olapegba is deeply passionate about leveraging technology to transform health systems and improve health outcomes across Africa. Mr. Femi Olapegba, please, you have the floor.
Thank you very much for the introductions, Dr. Dotun. And good afternoon, everyone. Thanks for having me here today. It's a pleasure to be a part of the GET Consortium. Today, I want to speak for a few minutes on digital innovation in Lagos State, the ship story, how we have gone so far, and what we've done to get this far. I'll speak on the journey, what smart health information platform is, what problem are we trying to solve. I'll speak on the vision and objectives of the project, I'll speak on the benefits and use cases. How will this platform achieve many of the things Dr. Nkero had spoken about. I'll also touch on the achievements we've achieved so far and the few steps we have, to take from now on. And hopefully I'll have a few minutes to answer one or two questions. So the ship journey, it all started in 2019 when the Commissioner for Health, Professor Akabayomi, took on the leadership of steering the wheel of progress of the Lagos Ministry of Health. He created a workshop where, an e-health strategy was developed for Lagos State. That workshop brought together many stakeholders, within the health family, and a lot of discussions were made. Many of the things the previous speaker spoke about as to the problems that are currently ravaging healthcare in a low and medium income country like Nigeria were brought forward, and strategies were crafted to ameliorate at the minimum, if not to curb some of these problems. So a major output of that workshop was a strategy document, and in it was for Lagos State to have a smart health information platform. That came as the center of it. And to have this platform, definitely there has to be a lot of stakeholder consultations. So the ministry started, engaging various consultants, stakeholders, and so on within the health and the other ministries related to it. There were needs assessments, and that also, apologies, is raining here. So my volume, I hope I'm still audible. So the rain is conflicting with my voice.
We can hear you loud and clear.
Oh, excellent. Okay, so there was needs assessment that were done to understand what is on the ground, what do we need to have, what is the variance. And after this was a competitive bidding through the Lagos State's PPP office. A number of organizations showed interest in building this platform. In fact, people came as far as Canada, the US, many countries many companies in Europe also showed interest. And after this whole process, our company, IntoSwitch Eclat, was became the preferred bidder, and that's why we are implementing this project now. So this SHIP is a PPP, a public-private partnership project through a concession framework. There's been a couple of business cases built together to establish the relevance of the projects. Professor Abayomi is keen on sustainability because that's, it's wanting to have a project running for the first year, have it still running. Am I still audible, please? My connection is
Yes, we can hear you.
okay. My connection flickered a little, so I thought I might have lost it.
No, we can hear
So
you.
that's it with milestones and how the project was vetted. So what is SHIP? As I mentioned earlier, SHIP is Smart Health Information Platform. It is a health information exchange that joins all health touch points together. It creates a single digital canopy that brings everybody within the health ecosystem in Lagos together. That's SHIP, and that's what we're trying to achieve. In fact, most of the problems highlighted by, most of the benefits of having a health information platform, as mentioned by the previous speaker, comes to light with SHIP, because it quickly accelerates access and quality of care. It quickly brings transparency and visibility for stakeholders into how health is being delivered. And what this brings also is it creates the platform and all the data and needed to make improvements in decision-making on the spot, improvements in policy making for the overall health coverage. The problems are staring at you in the face. They are, they've been quite emphasized earlier. No single data. If a patient goes from one facility to another, they keep registering them and they keep creating footprints. So harmonizing all this data for better care is a problem that is being faced. So when you hear some numbers, you want to query it because of these kind of issues. There's fragmentation, then there is poor data standards and all. And SHIP would solve these problems to a large extent because it creates a platform that secures connectivity, that stores data, that provides APIs and digital interfaces. APIs, application programming interfaces that allows machine-to-machine conversations. And at the end of the day, it makes everybody connected. In SHIP, we're implementing something we call the Master Patient Index. This ensures unique identification of patients. On SHIP, a major mantra we say is it is not possible to have duplicate patients. We have taken extra steps to make sure that doesn't happen. And as we harmonize and get data from various sources, we are able to achieve this. So the vision of SHIP are very clear. Universal patient ID, as I mentioned. It is FHIR-based, it provides a FHIR-based interoperability. FHIR, as mentioned earlier, fast healthcare interoperability resources, is the standard we've adopted for SHIP. And this ensures that all the various EMRs and health apps running in Lagos can communicate with each other using a common language, even though they might have created their software with different programming languages and their data stored in various formats. It also, our objective also with SHIP is to bring in remote monitoring, artificial intelligence and machine learning, and the several new technologies in robotics and many things that the fifth industrial revolution brings to us. Also, SHIP brings in digital infrastructure in the health facilities. One problem most of those facilities face is they don't even have the digital tools to convert the data from paper to electronic. So we're providing this to make sure that happens. We're integrating with DHIS2 and several other national tools as available. SHIP is also now digitalizing all the ministries, departments, and agencies of the Lagos State Ministry of Health. In fact, as we speak, we've digitalized about 3 of them out of 9. And the idea is to be able to do the remaining 6 in another 1 to 2 years. So, as I mentioned earlier, SHIP is a backbone infrastructure. In fact, for most people, you might not even know that SHIP is running because it is not something you would interact with on a day-to-day basis. Rather, it is the EMRs and your various health apps that will be communicating with SHIP. So it's a background service, and it serves as a switch. That's something that collects information from one hand and passes it onto another hand, even though these two hands might be 60 kilometers apart. Okay, and it just houses and inter-exchanges data as it moves from one side of the divide to the other. So definitely hospitals would interconnect, pharmacies, laboratories, agencies of the government, and several other stakeholders. I see people, the supporting partners like the WHO, and the several other organizations also having one way or the other to interface with SHIP. Three categories of players would benefit from SHIP. We have the patients, we have the providers, and we, of course, have the health policymakers. So this is what the platform will look like. So to your left is the ecosystem. So I've tried to picture a couple of stakeholders that are within the health ecosystem. And you can see the health information exchange in the middle, which connects all of them together. That's what we're trying to achieve. So we've got the patients, we've got the hospitals, we've got the private sector and organizations, we've got the regulatories, we've got the diagnostics, and so on. All of these people would interact, and all of the information will be inter-exchanged using the health information platform. SHIP, to the right, is the technology and the APIs that would be released. So SHIP would expose these APIs, and in the middle is where the interconnection happens. So FHIR is the interconnection standard, and FHIR ensures the data moves from the left side to the right side. Several benefits and use cases of SHIP. In the on a very simple terms, you quickly see early detection and disease outbreaks monitoring. Early detection of disease outbreaks through monitoring, alerts, and so on, because a lot of data will flow into SHIP, and then we can quickly see where trends are going above set limits, and alerts can be triggered. There will be enhancement with surveillance and reporting through integrated data sources and rapid case reporting. Definitely with resource allocation, the government would have more information to appropriately allocate resources, so we can prioritize the resources to where they would give us the best value. When I wear my hat of health economics, we would talk about cost benefit or cost effectiveness analysis, where we would look at how cost can give the best value out of things. So SHIP would give the data to be able to achieve most of these things in health optimizations. In fact, we thought of doing something like eco-virtual wards, where people would be able to continue care at home, so they can free up the beds for people that might need, that might be in more critical need of such infrastructure. Data-driven decision-making, improve public communication. Patients will definitely have access to their own data now, and they can be more involved in their own healthcare. And in fact, it also would help us drive consent. They said that to ensure a project like SHIP is successful, a critical component is to prioritize patient safety. Okay, and also ensure there's clinical accountability and transparency. SHIP would bring all of this to the fore. These are some of the API services that you begin to see us talk about. Ship care, identity service, the demographic service. Demographic service will be very useful when we talk about the integration with the National Planning Commission, where you talk about death registry and the birth registry. It helps us know how many people are really around. Prescription service, referral service, blood transfusion service, and several other services within the health ecosystem. So the idea is SHIP, as I mentioned earlier, would run in the background, and then it would allow these various services to run. What have we achieved so far? Well, we are the first statewide health exchange in Nigeria. Some I even say in Africa. We've onboarded about 10 secondary care facilities and 20 PHCs. Ship care number will start issuing ship care number next month. The ship care number is our unique identity. In fact, the number is so smart that it also embodies your other ID. So if you have your national ID, we can use that to identify you once it has been linked to your ship. If you have, say, a phone number match your account, we can use that to identify you. If you've got your state ID, like in Lagos, we have what we call LASRA, Lagos Residence Agency's number. We also can use that to identify you. Your NHIS or NHIA number can be used to identify you, and so on. So it's quite intelligent, and it unifies all these IDs into one. The health information exchange is already established. In fact, a couple of these facilities I mentioned are already testing their applications against our launch next month. The blood transfusion service, as I mentioned earlier, that about 3 agencies have already been digitalized. The blood transfusion service is one of them. Today in Lagos, the entire value chain of blood moving from the donor's vein to the patient's vein is digitalized. The entire process. We've captured all the labs, laboratories, and all the hospitals. They are interfacing under a single umbrella, and that digitalization is already in place. Also, we are finalizing the digitalization of EFAMA. EFAMA is the Health Facility Monitoring and Accreditation Agency. That also is being finalized. What that means is that there won't be quacks again in Lagos, because everybody that practices in Lagos would be digitally identified, and patients, Lagosians, will be provided with tools to let them know if a facility is operating outside the regulation. Next steps, we will be launching in October, as I mentioned earlier. We're finalizing our checks and our tests in the month of September, and by early October, we would launch with 5 secondary care facilities and 5 PHCs as a start. Then begin to expand to over 20 SHCs. In Lagos today, we have about 34 secondary care facilities and over 300 PHCs. All of these would get this SHIP infrastructure. And really, you can see how that would help us with our universal health coverage. We would be, in fact, starting with AI as we speak. We've integrated something we call the symptoms checker, where you can supply some information about yourself to one of our services, which we call the SHIP Intelligence, and it would give you an idea of what might be wrong with you. It's not diagnostics. I mean, it's not diagnostic. It won't tell you, oh, you got malaria or this, but it will tell you what might be wrong and what you should do next, which usually will be that you need to see a doctor or you need to take more water, and so on. We're already using AI to achieve some of these things. We'll be moving this into disease surveillance and other resource allocation concerns of the government. We'll also be approaching regional and national interoperability. I learned that the Federal Ministry of Health also is planning to put together health information exchange. We would be interfacing with that. We'll be digitalizing all the other MDAs in Lagos. And to a large extent, our aim is to make Lagos State a medical tourism hub where people would want to come and get themselves treated instead of the reverse, which we see today. Thank you. And I'm happy to answer a few questions. I hope I didn't take too much time.
Thank you very much for Mr. Femi for that very detailed presentation, and congratulations on the fantastic job your organization is doing in Lagos State, setting pace like Lagos State always does. And this, I strongly believe, will bring a huge innovation and positive change to the health system in Lagos State. So without much ado, I'll go straight to our next speaker. And our next speaker is Dr. Mercy Wanjala. Dr. Mercy Wanjala is a graduate of the University of Nairobi School of Medicine. She holds a master's in comprehensive general medicine from the University of Medical Science, Havana, and an MBA in healthcare management from Strathmore University Business School. Dr. Wanjala, please, you have the floor for about 20 minutes. Thank you for joining us on this platform.
Thank you very much for that wonderful introduction. And also thank you for the speakers who have gone before me for taking the stage. So for me, my task this afternoon and for the next, I hope you can you still see my slides?
Yes, we can see your slide.
Okay, all right. So for the next 20 minutes, my task is easy. Just give me a minute for me to set this. I just want to take us through some of the aspects around data management and governance that are key in ensuring that our data as Africa can actually give us better health outcomes than we're getting right now, and can also help us in health planning. And I'll be giving us examples from what Kenya has been doing right now since 2023 in terms of ensuring that the whole healthcare system is digitized by creating a digital health superhighway. So just to set the scene, some of the issues around why this topic matters today is how Africa over the years has been failing in terms of getting data that matters, measuring what matters, and also ensuring that what you measure can be improved. And then finally, what you're measuring and what you're improving gives us better health outcomes. So one of the reasons why this has been difficult for us is the siloed donor-driven tooling. So we have so many different tools, so many different systems that we're trying to implement at the same time in the national healthcare systems that we have. Same healthcare system, same patients, same workers, but very many different tools and very many different systems, which are backed by donors, operated by donors, and therefore for donors. So what we measure is not what matters to us, but what we measure is what matters to the donors and to the programs. Another issue is the issue around frontline overload, where the primary care workers especially have so many duties. They have multiple registers that they need to fill. They need to see the patients. They need to track the data. They need to report the data at the end of the month. So that overload also makes getting quality data very difficult, because they have to spend so much time filling the data and making sure it's accurate, and also see patients. And most of the time, what is politicized and what is expected of them is to clear the queues. So someone would rather get the data wrong and see the patients than get the data right, or spend time trying to get the data right. Then the other issue is around counting while not learning. That means we are chasing a lot of inputs, outputs, and inputs into the data, outputs from the data, rather than the outcomes and the impact. Therefore, we're not able to learn properly from the data that we get. Another issue is the indicator drift, where there's no single glossary around what indicator are we measuring, what's the denominator, what's the numerator, what does it mean? Sometimes you find that across the programs, this keeps changing. And last but not least, the issue around interoperability, where we have so many systems, not only in the healthcare system, but also in the civil registration, and the data there also matters to healthcare. But these systems are not able to speak to each other. So it makes it very difficult to get accurate data, makes the data very patchy, and also makes the issue around how do we ensure data quality. And we're getting quality data very difficult, because if you cannot compare the data across systems, such as the same child that was born in hospital was the same child who was registered by the civil registry, was the same child who was registered by the system that registers them when they go to school. So such things, if you cannot compare across systems, then it weakens the healthcare data that we get and our ability to use it for planning and also to get better health outcomes. Moving on to my first point, I like using quotes because I find they help you see the concept and also understand the concept better. So the first one is around what we measure and how we are measuring it in the healthcare system. So what gets measured gets managed. So if you don't measure something, you're not going to be able to manage it. So that's why it comes to the foundation of getting health data right, which is what are you measuring? Are you measuring what matters? And are you measuring what you want to manage? So sometimes we rush so much to get the dashboards right, to get the reports right, but we're not thinking about what exactly are we measuring or what exactly do we want to measure. And where there's no data, there's no accountability. So that means this data needs to be visible, disaggregated, and it needs to be timely. Because if I need to measure a decision, if I need to make a decision now, that means I need the data now and not later, not at the end of the month, not at the end of the week. So how am I going to get what I'm measuring out of that system fast enough? Then the other thing around facts do not cease to exist because they are ignored is how sometimes we choose to only see what we want to see and not what the data is actually telling us. And ignoring data costs lives and it costs money. If you look at the outbreaks that we've had in different countries in Africa, starting with COVID-19, Ebola outbreak and response, amongst others, you will notice that missing data actually made it difficult for people like epidemiologists to actually do proper modeling, proper projections, and therefore proper planning. So missing data or data that we ignore or things that we decide not to measure can actually be very costly within the healthcare system. And remember that without data, you're just another person with an opinion. So if whatever you're saying cannot be backed up by data, then it just becomes an opinion. So that's why as we're building our digital health systems, we have to think about what exactly are we measuring? Because remember, digital health, as mentioned by the speakers before, is here to support the healthcare system and not to replace it or not to entirely. So human beings are still in the system. So many other factors are still in the system, including infrastructure and the rest. So if you do not consider all those things together and you just digitize what you have not decided to measure or you've not understood what you need to measure, then at the end of the day, you will not get good data, which brings me to my next point, which is around garbage in, garbage out. That is one of the most famous quotes for anyone who has attended any computer class. So Kenya right now has enacted since 2023 the Digital Health Act, has a digital health agency. In 2024, last year, we enacted the digital health regulations and started a full countrywide digital health superhighway that is connecting all the way from the community through the community health promoter and the community health information systems to all the way to the national referral hospitals. And this digital health superhighway is supposed to help solve some of the problems that I mentioned earlier. But one of the places where we are still struggling and unsolved problems that we still remain with is the human factor problem. Because at the end of the day, as much as we have these systems, it's still a human being at the end of that system who has to input the data. So not much investment and not the adequate investment have gone into ensuring how do we support the healthcare workers of the front line to fill in correct data and quality data. So we have issues around, for example, connectivity. system lag times and system downtime. So you're in the middle of seeing a patient and the system, you get a system downtime. Of course, you're not going to wait for 30 minutes, 1 hour for it to come back up for you to see the patient. You're going to see the patient, record the data however you're going to record it, and then think about what you're going to do after. So all the things that we are putting in place, including ensuring the network works well, the servers are properly backed up and are adequate enough so that you don't have these system downtimes and lag times. So doing all those things in the name of supporting frontline care, healthcare workers is a key ingredient to making the system work. Because right now, most of the things we're suffering from are error in the data, wrong data, inaccurate data, missing data, which all happens at the point of entry. So whatever you put in is what you get out. And the problem now we have is most of the time, data, when it comes to trusting the data that comes from most African healthcare systems, there's a problem there because we are not investing enough in ensuring that the data that is put into the system is accurate, it's correct, it's timely, and all those things. So one of the important things that we have learned through the process is issues of mapping processes. If you cannot describe what you're doing as a process, then you don't know what you're doing. If you cannot describe the data entry process, then you don't know what you're doing. So defining processes across the value chain of health data is very critical, and we have seen is a very critical thing. So right now, one of the things that the team at the national level and also the developers are trying to do is map out clearly the process so that they can ensure that the data they get in is accurate and can actually be used for decision making. Which brings me to the next point. Anchored around silence is the best disinfectant. Why do we say this? Issues around transparency and building trust. Building trust with the system that you're building and creating, building trust in the health data that you get from that system is actually very critical. Because if people don't trust the system, then you'll be digitizing records, you'll be digitizing processes, but the patients don't trust the process, the healthcare providers don't trust the process, the policy makers don't trust the data that's coming out of the process. So good data governance is the operating system for data. That means investing in the people and ensuring that people are trustworthy and have integrity enough to fill in the correct data and ensure that if the data is not available, they don't fill some abstract figure for the sake of filling it because the system demands that they fill it. Having rules in place that ensure the data is actually accurate. Because if, for example, someone fills in the age of a teenager as 25, the system should be able to immediately detect that and reject it. So building in such things within the system is very helpful in terms of ensuring that we get data that we can use for making decisions. The other thing that helps with trust and transparency is clear roles. Most of the time when a digital health system is being launched, there is no clear definition of roles in terms of who's the data owner, who's the data steward, because of are all different roles that need to come out to the light, but it is very clear who is the data custodian and who exactly is the team lead for all these people. So for example, an example of a data owner, for example, is the director of preventive and promotive health at the national level. Then when you come down now to the subnational level, you have the data steward being maybe the county health records information officer. And they need to have this clear role with clear appointments and also clear terms of reference as to what are they doing with this data. And then at the end of it all, it needs to be very clear in, for example, their performance contract that you are a data owner. These are your terms of reference, and this is what you're expected to do with health data. And at the end of every month, at the end of every quarter, this is what is expected of you. So having those clear roles and is also going to improve transparency and also trust in the data. Which brings me to the next point, which is around creating an operating model that works. And on this, I'm going to give an example from the Cuban healthcare system, where plans are not just made, planning is done, and it is executed almost immediately. So Cuba starts the neighborhood with what we call consultorios with family doctors and family nurses at the community level. And this primary care team, what is very fascinating is that all their records are manual because the country does not yet have the infrastructure and technology to digitize its health systems. But its health records are accurate and they're actually complete. Completeness rate goes above 90% in terms of completeness of the data. So what has helped this system work like this? One of the things is the integrity of the family doctor, the family nurse, and other frontline healthcare workers, such that this is part of their performance contract, how accurately you fill data. For example, there's a manual and an instruction sheet on how do I fill this particular form. And things like crossing out the form, erasing things on the form is not allowed. So you fill it with pen, and you cannot rub, you cannot cancel. So such things help to promote data integrity. And if you have to cancel, you have to sign against whatever you have canceled to say, I was correcting this. So that is just an example of how creating and modeling a system that can actually give you the data that you want and measure what you want and ensure that your data is complete is very important. And remember, well begun is half done. That means you don't have to begin with every single facility everywhere or every single system everywhere. Begin somewhere, test it out, and see what works best. Because I know for some of our African countries, we're still on the manual system. Some are still in a hybrid system where they're using manual registers and also using digital registers. Some are now fully digitized. But whatever system it is that you're modeling, you have to ensure that one, you have a concrete plan. Two, spend as much time as possible planning how you're going to move from the data entry stage to the data use stage. And also spend a lot of time understanding what are the different processes that are going on between the data entry up to the data use, and ensuring that you have stopgap measures throughout those processes to ensure that you get the correct data. So if you're anticipating someone might miss, for example, a particular data entry, what are the things surrounding that you could take care of such that you ensure they get the correct data and they don't have any missing data? Because strategy without tactics is the slowest route to victory. We have that digital health, for example, strategy, digital health policies. But what are the tactics you put in place to ensure that these policies are actually implemented the way that you envision? So those are some of the things that we have been learning in the process that now we have the Digital Health Act, we have the Digital Health Regulation, we have the Digital Health Strategy. But now, what are the tactics that are going to help us get the results that we want? From habits to culture. Quality is not an act, it is a habit. That means the DQAs that you do at the end of the month or at the end of the quarter are not sufficient to ensure that you get quality data. And the first step is to ensure that your processes are very simple, such that you don't need an Einstein to come and use your digital health system or to use your healthcare data or to extract your healthcare data. Make it as simple as possible, and then practice, 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 and make it a routine. So, for example, if you want to check the completeness, accuracy, timeliness, and consistency and uniqueness of the data, ensure that you have, for example, things like daily quality handles. That means you take whichever team is working, whether it's a sub-county team, a facility team, on a daily basis, just take 5 to 10 minutes and look at the data that you got yesterday. Does it make sense? What are the gaps? How can you improve the gaps today? So those are some of the small things that can be done at the facility level to ensure that you get the correct data. And that is also part of good data governance, having checks and balances to ensure that you're doing the correct thing on a daily basis. When it comes to now the data quality and data quality reviews, one of the places that you will never do the data quality audits and reviews is upstream. That is the place where the data is entered. Because we look at the end result and we're like, this data looks like this and it's not right. But we don't go back and ask ourselves, was it that it was entered incorrectly? Was there a bug in the system that maybe misrepresented the data? Can we compare across different systems and see if this data actually makes sense before we can say it's either good or bad data? So thinking around how do you ensure that at the end of the day, your data quality audits actually matter to you. So first of all, you have to do the hard work to make it simple. That means you have to sit down and come up with a plan for data quality audits across the spectrum, whether it's daily, weekly, monthly, and it has to be as detailed as possible, because these are some of the things that will help you in the long run when you're doing your data quality audit at the end of, for example, a quarter or a year. You'll be able to map out and say, week one, these are the issues we had. Week two, these are the issues we had, and even from a daily basis. So you have to do the hard work, first of all. You have to do the hard work so that the rest of the work becomes simple. And then also what we lack is that peer-to-peer learning, whether it's from country to country within Africa or from facility to facility within at the sub-county level, at the national level, from one county to the other learning. That peer learning and also peer data audit is very important. So you get one facility in charge to validate the data of the other facility in charge, and then from there they can learn. That's a very important tactic to have in your arsenal. Then remember that the whole is greater than the sum of its parts. What do we mean? You have to make the systems speak to each other. Yes, we are focusing on the healthcare data system right now. But remember, healthcare data relies on data from the education sector, from the civil registration sector, and other sectors as well. So aside from making the systems, the digital health systems and other tools and registers within the healthcare system speak to each other, we have to think of how can we also extend that to the systems that are connected to the healthcare systems and make sure they speak together and to each other, and they also connect. So thinking about, there's so many different ways that you can ensure that they connect. For example, from the foundational level, for countries that have not started this, start thinking about how these systems can speak to each other at the foundational level when you're just starting out. Don't wait until you have different systems in the different healthcare, in the healthcare sector or in other sectors for you to think about interoperability. It is easier done at inception than done later. That's what we have learned in Kenya right now, as we are trying to make different systems that we have, like KHIS, and then the Kenya EMR that now collects data from the facility, and then the community health information system that is ICHIS. We're trying to see how can they speak to each other. But had we begun this together at the foundation, it would have been easier, because right now it's a matter of rewriting code, rewriting systems, and thinking about how we can do that. The next thing I'm going to speak about is the issue of standards. What is your standard in terms of your data quality, data governance, and data use, health data use? What are your standards? And what is your standard that sticks? Because the thing about standards is sometimes standards change. So how do you come up with a standard and how do you make it stick? So these are just some of the various systems that are there in place, like the fast healthcare interoperability resources. So there are various types of them, and if you talk to your developers, for those who are in this field right now trying to digitize your healthcare system, they will give you ways and processes of ensuring that things like the patient encounter observation, immunization program, different programs can actually be put and can actually have similar standards across. Because remember, as I mentioned the issue about programmatic and siloed responses of organizations within our system that make it very difficult for us to have similar standards across. So these are some of the ways that you can have similar standards across. Then we have the systematized nomenclature of medicine and clinical terms. I think the first speaker from WHO mentioned this. What are you using? ICD-10, ICD-11. What are you using for primary care data capture? So such like things you have to think about them early enough, because if you think about them later, then it will cost you a lot of money and it will bring a lot of confusion in the system in terms of now telling healthcare workers, hey, I know you've been using ICD-10, but now we are moving to ICD-11, and this is a new nomenclature. Right now, we know we are at ICD-11, for instance. So as you're developing your system, why not just go into ICD-11? Why not just use what is the correct nomenclature, for example, for primary care problems right now, instead of thinking about it later? So those are some of the standards that you have to set earlier on to ensure that you do not have issues. And remember that you cannot build on a faulty foundation. What do I mean by this? If already the system that you had that is not digitized, for instance, if the system that you had so many errors, had missing data and all that, unless you address those problems first, you'll just be building on a faulty foundation. That is looking at the point of capture quality, pipelines with contracts. Do people have a contract around, for example, data use, data sharing? If they do not exist now, then when you digitize the system, it will not help solve that problem. So you have to think of having a very strong foundation on how you manage health data before you build on it with digitization. Next, remember culture eats strategy for breakfast. And I usually add there breakfast, lunch, and dinner. Why? Because if you already have a culture where you don't respect data, where the clinical process does not include accurate records of patients, accurate records of events, for example, outbreaks, accurate records of, for example, things like stocks within the healthcare system, inventories within the healthcare system. If already you do not have a strong culture around saying healthcare data is important and healthcare data includes ABCD, then whenever you inject things like new innovations like digital health systems, AI, you will still get the wrong data. You will not get quality data that will help you. So remember, first of all, to work on the people, work on the culture so that you can set a strong foundation for innovation and data use. And remember that with great power comes great responsibility. Health data is very sensitive. So good governance dictates that you have policies around data protection. For example, Kenya, we have the Data Protection Act. Now we have an office of the data. We have an office of the data protection and rules and laws on how you can share data. And it has been enforced such that if, for example, today, this day and age, as a doctor, you by any chance, accidentally or intentionally, share patient data without following the correct procedures, you will be prosecuted in court and you will be charged and you will actually pay damages. So it's very important that that becomes part of your healthcare system. Because if people can't trust that you will keep their data secure, they will always give you incorrect information. But as long as your data system within the healthcare system, within your facilities, is sealed by having a correct data owner, data steward, data custodian who have signed data use agreements and such, then people can trust that system and you'll always get good input within your system. And remember, a goal without a plan is just a wish. When you start, this is just an example of a 12-month roadmap of how you ensure that you have good data and good data governance. A good practice is to have a data governance council. That council should have clear data steward, data owner, data custodians, and a clear map of how they interact with each other and how they help each other ensure that you get accurate data. And remember that you cannot improve what you don't measure. So if there's anything within your system, whether it is stockouts, whether it is, for example, vaccine management, medicine management, such that you ensure that you don't run out of medicines and such, if you're not measuring that process of getting medicine from the time it comes from the manufacturer to the time it's given to a patient, then you will not be able to improve that process or improve outcomes by ensuring you don't get stockouts. Because a lot of time we get stockouts and we get, for example, we can't even measure how many healthcare workers we need in our facility because we don't have the data and we're not measuring it. So if we can't measure it, we cannot improve it. And let's move from talking to action. We keep talking about digitization of health. We keep talking about health data. We keep talking about having our own data, owning our own data, in fact, within the Africa region. But now it's time to take action. It's time to innovate. It's time to learn from each other. It's time to collaborate and not to compete, and ensure that whatever lessons we're learning across, whether from Nigeria, from Kenya, we are able to, one, publish it, two, have sessions like this where we share best practices and best success and what works, and ensure that at the end of the day, we act on the things that we talk about. If you're talking about data quality, define it, have a plan for it, and ensure at the end of it, you have outcomes and impact that you're looking for. For example, if I say I want more than 99% or 95% completeness, that is something I should be able to measure at the end of a 12-month period and say, 95% of all the data I collected in my system is complete. We have to go that granular and measure and ensure that at the end of the day, we get the results that we want, we get data we can use for planning, and we get data that can eventually improve health outcomes by improving the system. And remember that every system is perfectly designed to get the results that it gets. So if you're getting bad data, it's because you've designed a system that gives you bad data. If you're getting incomplete data, you have designed a system that gives you incomplete data. And at the end of the day, if there's no data privacy, no data security, it's because we have created a system that allows people to share data without, for example, proper consent. You have created a system where there's no data custodian, there's no data there's no overall data owner and data manager. So think about the system that you're creating and think about what today is my greatest bottleneck in terms of health data. And is there something I can do right now that in the next 90 days, the next 3 months, I can be able to say, I was at 50%, for example, completeness of my data, but now I'm at 100%, I'm at 50, I'm at 60%. So start small and think of data, health data as a concept. What concept are you trying to implement? What concept are you trying to improve? And how will you know that you have improved it? And with that, thank you very much. I hand it back over to our host.
Thank you, Santi Sana, Dr. Mercy, for that very detailed presentation and overview of life cycle, what I call life cycle of health data management. That was indeed a very nice presentation. And let me remind our speakers that, our participants rather, that with the permission of the speakers, we are going to share the PowerPoint presentations with them. And also we're going to give a certificate of participation to all the attendants that we have their record participated in the webinar series today. So that is important that I share. Finally, we're saving the best for the last, and we're going to our last speaker today. I will take a bow for about 1 minute and hand over the platform to her. Last speaker for today is Dr. Busola Shonowo. Dr. Busola is a health professional with over 13 years experience across healthcare industry, both as a clinician and a healthcare consultant in Nigeria. She brings more than 9 years of strategic healthcare consulting expertise, having provided advisory and implementation support to a diverse range of stakeholders, including global health firms and NGOs, healthcare entrepreneurs, and startups. Dr. Busola, we thank you very much for joining us on this platform today. You have the floor for about 20 minutes.
Thank you very much, Dr. Dalton. Okay, hope you can see my slides.
Yes, we can.
Okay, great. My name is Dr. Busola Shonowo. Thank you for the invitation to this webinar. I am Manager Health Tech with another group, and I will be speaking on laying the groundwork for policy, infrastructure, and capacity for sustainable digital health in Africa. The good thing is all the three previous speakers have spoken to different parts of my presentation already, so I will. We already, like the first speaker said, across Africa, we're seeing an incredible rise in digital health adoption, from EMRs, from electronic health records to mobile apps, and now to artificial intelligence, which is the new big thing. And while we see the technology everywhere, we often see these fragmented systems as well. The systems don't speak to each other, and projects that end as soon as donor funding ends, they collapse as well. So this is why the groundwork is so critical in allowing, in creating an environment that will allow digital health to thrive. Without policy, infrastructure, and human capacity, innovations will remain fragile. So let's first talk about I'm going to first talk about where we are in healthcare and what digital health is, and then I'll go on to policy, infrastructure, and capacity, and then I'll finish with my position. So here we can see a snapshot of where healthcare is in burden, but less than 5%, I believe, of the workforce, with the Japa syndrome making that, many times worse. We have large and fragmented and inconsistent large systems that deliver inconsistent quality due to a lack of decades of underinvestment in the sector, which has left many countries with very fragmented and insufficient systems. And in many respects, the healthcare provision or healthcare delivery market still remains an untapped market in Africa, as there's still a wide and vast established demand for quality care. Now, what is digital health? It's really just the convergence where digital technologies and healthcare meet to enhance the efficiency of health delivery and to make medicines more personalized as well. Now, previously, digital health was known as mHealth and really focused more on electronic health records or medical records, but now it has evolved. We've now seen the rise of telehealth across board and big data, and now we're moving into things like wearables and other forms of digital health. And what is driving this use? As you see the bottom right graph, Africa has pretty much the largest, this data is a bit old, but it's still relevant. The current data still shows the same trend. Africa has some of the largest mobile phone and mobile internet connectivity in the world, and the speed is continuously growing year on year for the last 10, 15 years or so. It has just been a positive growth. So this shows the potential and the demand and the use that, the opportunities rather, that digital health has, especially mobile-focused digital health. Now, digital health, as we all know, is complex and involves several different parts. It's a very multi-layered and layered system and ecosystem. So this is why policy is so important at setting the stage. Now, the whole idea of policy in any country, and I'll try to speak more Africa focused because we've had a lot of information on Lagos and Nigeria. And so countries need to provide national strategies, clear digital roadmaps. There are 5 areas we see that policy can affect the sustainability of digital health in Africa. And these 5 areas are here, national strategies, strong national strategies, frameworks, and roadmaps, which will lead to strong data, which will lead immediately to data governance, like Dr. Mercy just covered extensively. Data governance, strong data governance sets the tone for good quality, good privacy, ethics, and security, and all the things you spoke about. And when you do it before rather than after the system is already in place, you are able to reduce the mistakes. But it doesn't mean that if the system has already started, like most countries in Africa already have some form of digital health ongoing. So people still, the governing bodies and regulatory bodies still need to come together and put together a framework that all businesses and organizations can facilitate, can also come and align with. And this, like we've seen in Lagos, the SHAPE is doing, in Nigeria, and the federal government is doing the Digital Health Initiative. These 2 systems, the Digital Health Initiative is, is a federal parastatal, and the SHAPE is Lagos focused. But I follow these 2. I've been following these 2 for a very long since 2019 for SHAPE in particular, which was just before. I remember when they did the launch just before COVID, and I was very excited because it was something we had been looking forward to for a long time, because the platform is essential. The foundation, it sets the foundation and it allows many things to build on top of it. And this will also then lead to, when you have proper strategy, proper roadmaps and governance, and then standards and interoperability comes naturally. It reduces the fragmentation. We currently have lots of silos in telehealth, in medical records, in logistics. Everybody's doing their thing in their own silo, but we need a system that can speak to each other. And then financing is also very key, because this is going to move us from short-term donor projects and move it into long-term integration into healthcare budgets, which is key for sustainability. And the final step in policy in closing this ecosystem would be cross-border regulatory harmonization. We already see this in manufacturing and other areas like the African Free Trade Agreement that is ongoing. These things are necessary to enable cross-border movement of delivery of healthcare services. Then speaking about infrastructure, these are basics, but they're still in Africa big problems: connectivity, reliable internet and power, which is the foundation of all technology. Until that is fixed in the several different manners and ways which we have solar, and we have all sorts of alternative means of power now. This needs, every facility who is serious about using digital health is going to have to solve that problem first. Next would be information systems. Now, having a robust systems is necessary, but the platform, like we spoke about, that to allow these systems to speak to each other and to allow interoperability to be a standard, not just something that happens among certain businesses. Because this interoperability is key for gathering the data in one place and being able to properly analyze the data. Same thing for allowing this platform will also now create support to allow insurance and digital payments, so that will fully make the entire value chain end-to-end digital, where people can book, from booking an appointment to talking to your doctor to paying for all the services you received. Everything can be fully integrated into digital methods. And this would only happen when good data security systems, where people can be sure, because like the first speaker said, health data is some of the most valuable data in the world. It contains people's personal information, their addresses, it contains their medical information. It also contains their line. So if hackers get into the system and are able to access that data, that is a lot of information and significant loss, both for patients and facilities. So in building this infrastructure, we must also recognize rural areas across Africa, and this remains critical and must be factored into any innovations that are trying to tackle the infrastructure issues. Then we speak about capacity. Now, digital adoption hinges not just on the technology, but also on the people. And capacity building, in my experience, should focus really on 3 areas. Number one, healthcare workers, who are the primary people using these tools. I once worked with a health tech company where we onboarded a hospital in Lagos, where the matron didn't have an email address. So we had to start from scratch. And this is the norm, really, for a lot of senior healthcare workers, where their level of technology literacy is quite low, especially in healthcare industry, which is surprising. But a lot of work has to be done in training these workers to enable ease of use of the tools that will be brought on. The same thing for local tech talent. A lot of the systems we are using now, initially when EMRs first came to Nigeria, if something went wrong, the systems were brought from outside the country, they weren't built in-house. And when you needed something, you wanted to add something or take something off, you needed to wait for the guy in India or wait for the time when, the time difference and different things. So having local tech talent is extremely important to support, because you need a base of local talents available locally that can provide support services to support the technology being used, and also to both training the people and teaching them how to maintain the technology being used. And finally, also in the area of regulatory and overall leadership, you need to strengthen their capacity in building policies. Going back to policy again, we need to strengthen their capacity to govern digital health in all areas, like the previous speaker had mentioned. And so that way they can own and drive the digital transformation across board. And there are many opportunities. These 3 areas, show us there are many gaps that have been identified, but the opportunities are also massive. The opportunities are clear in several different ways. We speak about, we have a company like Intron Health who has an AI speech to text tool, which they initially did an EMR, and they discovered, which across Africa really was a problem, was that most of the EMRs, most of the facilities rather using, or I'm not using the facilities, the doctors, the healthcare workers using the EMRs, the amount of note taking dropped. versus when using paper. When people were used to writing long, detailed history notes, but when it was time to type it out, people just write summary and leave it. So they said, okay, let's see how we can fix this. And they developed an AI tool to help with transcription. And they used AI to train it in over 200 African accents, which is another big issue. A lot of the existing transcription platforms we had then didn't understand the African accent so well. So when you're using it for transcription, you still have to edit afterwards. But they were able to close that gap, and really the tool is now being used in other outside healthcare, it has other use cases outside healthcare, but it's still very relevant in healthcare. They have seen clear increases in the uptake in the use of in the notes being taken on their EMRs across board, and they've been tested in many countries across Africa because they have so many languages. So this is just one example of use of how we can look at the gaps of what is on ground, and then try to see how we can use technology to close those gaps. Now, the groundwork, is not for the groundwork for digital health is not the responsibility of one group. It requires collaboration across board. We need governments to provide policy and regulation. We need private sector to come through with financing and innovation, the developmental partners as well, when talking about building capacity and scale. And we also need civil society and academia to continue research and training and advocacy. Now, if we can achieve this across-board collaboration, we should be able to achieve a balanced ecosystem, right? Where all the sectors and all the stakeholders can come together and can understand their roles, and where innovation, can thrive, which will lead to sustainability of the system. And if we get it right, digital health in Africa will succeed because the foundations were built. Any questions, please feel free. Over to you, Dr. Dalton.
Thank you very much, Dr. Busola, for that very detailed presentation. And I think with our presentation, we'll come again to the end of the August edition of the GET webinar series. With the presentations of the four speakers, we've had a very holistic look at digital health in Africa, starting from WHO, what WHO is doing, and an overview of what is happening in Nigeria. From there, we'll move to Lagos State with the RESHAPE project. I'll give a detailed overview of what Lagos State is planning. And we'll move across to East Africa, to Kenya. And we had a discussion around digital governance and digital health data management. And we'll end there with Dr. Busola that gave an overview of what is happening within the country. So thank you very much to our presenters. You are the reason why we're doing these things every month. And thank you for sharing with us from your very, very wealth of experience that you've gathered over years and decades. We appreciate your presentations. They are very detailed, and personally, I've learned a lot from digital health and data management today. And also, I want to say a very big thank you to our participants. You are the only reason why we do this every month. If you organize a webinar and nobody attends, then there will be no reason to continue. But because we see tens of participants every month, that's the reason why we're always eager to continue to organize this monthly. So we'll say a very big thank you to all our participants for staying with us in the last 2 hours. And like I said, we're going to be giving certificates to all participants before the next webinar that will be coming up in September. We're also going to be sharing the presentations with the permission of our speakers. And we'll continue discussion on this on our various platforms. And at the end of the day, one of the things we'll do is to produce a policy brief from each of the discussions, of the webinar discussions every month, so that at the end of the year, we have a comprehensive, holistic policy document that can be useful for decision-making at the subnational, national, and regional level. So we spent about 2 hours on this platform, and is one of our principles that we should not spend more than 2 hours. So thank you very much in the last 2 hours for staying with us in the last 2 hours. We have to end this webinar now. We say a very big thank you from the GET Secretariat, and we are going to meet this time next month by God's grace to discuss another very important topic focusing on One Health and biosecurity. Until next time we meet, we say a big thank you from Secretariat of Global Emerging Pathogens Treatment Consortium, and we wish you a very fantastic rest of the day. Thank you to our speakers, thank you to the participants, and bye for now.